Welcome to another edition of the video podcast of the Air Rotation here at the University of Florida. My name is Felipe Urdaneta, and we're going to be discussing an article recently published that talks about the identification of the cricothyroid membrane, that elusive membrane that we know that it's a crucial aspect of accessing adequately the airway in case one needs an invasive option. And the study was published in Canadian Journal of Anesthesia. The volume is 62 on page 495. You can find it in the blog, of course. And the title is Accuracy of Identification of Cricothyroid Membrane by Anesthesia Trainees as Staff in a Canadian institution. This was done in Halifax, Canada. And why this is important is because it's the third article in a series, obviously non-related, that talks about difficulty in clinical access of the membrane. Obviously, it's important as well because it identifies two different populations. One is male patients and the other one's female patients. And one important aspect is that it distinguishes between obese and non-obese population. Obviously, we're dealing with an obesity epidemic, and this is why it's important. Now, in the previous study, in one of the studies that I've mentioned about in 2012, it showed that in females it was much more difficult to identify the membrane. It's not surprising since the thyroid cartilage is not as prominent as in males. And in that particular study published in Anesthesia and Analgesia in 2012, it showed that the accuracy was only 18%. So this particular study, as told you, this is the conclusions and this is the results of the study, showed that if you were a non-obese male, there was a 72% chance of identifying the membrane adequately. If you were obese and were male, the chances dropped to 39%. Now, on the female side, then the results were much less enthusiastic. It was basically, if you were a non-obese female, it was 24% accuracy identification, and if you were an obese female, the number went up to 35%. I quite don't understand why obese females, obviously in that population, were higher, but nonetheless, if you compare the males to females, then there's a big difference, and if you compare obese to non-obese, there's obviously a big difference there. Now, it obviously points out as what is the best way to identify the membrane, and I think that's the holy grail of the whole preoperative evaluation. And obviously you will think it's ultrasound, and indeed ultrasound might be the answer. However, I think further studies need to be done to basically be able to use the ultrasound specifically in males that have prominent thyroid cartilages, because it's very hard to keep an adequate contact between the probe and the neck in patients that have that prominent thyroid cartilage. But nonetheless, ultrasound is indeed a great tool to be able to do that. Now, the other thing, it also points out that once again, it may be that the open technique for emergency access of the airway might be beneficial, because if you do a vertical incision in the midline, then you can then palpate the membrane or the cricothyroid membrane or the thyroid cartilage easier than if you just basically try to locate it with a needle. So once again, it tells you that the open technique might be beneficial, and using techniques such as the bougie-guided cricothyroidotomy or the stylet doing it, or the newer technique that's coming out really soon, which is the Cric and Cric might be the way to go. But what the conclusion is should be that is we're in 2015 and we're still struggling to do this, and my guess is that we'll be struggling for a long period of time further, because obviously obese population happens to be one of the major obstacles that we have. So I look forward to you reading the article and to send me your comments, and if anything you want to discuss or something, just send me an email. And thank you again for watching this podcast. Bye-bye.